Hello, hello. Here we are again, working with the chapters on vitamins, minerals, and antioxidants. This section is going to deal with micronutrients for bone health, specifically vitamin D and calcium. There are a lot of other nutrients that are important for your bones as well. That would be things like phosphorus, magnesium, and fluoride, and vitamin K. But these two particular ones have a lot of good research for athletes and are considered nutrients at risk for athletes. So that's why we're focusing on those. All right, so in terms of calcium, what does it do for what does it do for you? What does it do for bone health? And how much do you need? So just kind of some fun facts about calcium. It's the most abundant mineral in the body. It's really important for the function, the structure of bones and teeth. You need it for nerve transmission, muscular contraction. In terms of amounts that you need, you guys looked this up earlier in the semester, which is kind of neat that we're talking about this again because it goes back and reinforces concepts we learned in the beginning when you did your nutrient analysis. And so you had to write down everything you eat, you had to eat, and then you had to see how much calcium you consumed and then compare it to the recommendations. So males typically need about 1,000 milligrams a day if they're athletes, female athletes about 1,000 to 1,300 milligrams. And even some athletes who are at risk may have higher needs. And so we want to talk about identifying athletes that could be at risk. So like many times, the athletic trainers will refer athletes to me that have stress fractures that aren't healing. And they'll want me to look at their diet specifically, for calcium, vitamin D, are they eating enough calories? Um, um, Women athletes that don't get regular periods, that's a sign of hormonal imbalance and low estrogen, which can cause calcium loss from the bones. And never really had an athlete that experienced sweat losses so high where they lost calcium, so much calcium that it caused things like cramping, but it is a possibility. All right, so I wanted to just kind of go over some things that could happen if you don't get enough calcium. So, a lifetime of calcium deficiency could result in a condition called osteoporosis. So, here we're looking at a drawing of what is supposed to be very strong bone. So, your bone is kind of a lacy, lattice-like network. This is the bone right here. It's called trabecular bone. And then osteoporosis, you have a definite loss of bone density and bone mass. And you can see how the bone, you've actually lost bone and the bone that's left has become quite thin. And so here would be a drawing and you can see holes here in the bone and much larger spaces in the lattice-like network. And why this is so bad, it makes you at a much greater risk for fractures. So over here, we're going to talk about stress fractures. And so stress fractures usually occur in the leg and the foot, and they're just tiny cracks in the bone. And that's what we're looking at right here. And so I'm not really encountering athletes with osteoporosis, but I do work with athletes that have stress fractures and trying to get them to heal. Diet is obviously a big component of that. And then, as I mentioned, yes, it is entirely possible if you had a calcium deficiency that it could cause a cramp. But I would really like to emphasize that if you're experiencing leg cramps, I highly doubt it's from a calcium deficiency. But here you can see the muscle at rest. Here you can see the contraction when the muscle is flexed. But when you have a cramp, the calf muscle doesn't relax, and that causes that painful sensation that you get. All right, so anyway, you guys are now familiar with stress fractures, muscle cramping, and osteoporosis as side effects of having calcium deficiencies. All right, so now let's talk a little bit about, where can you get calcium? This is what it's all about, right? So let's kind of move me up here in the corner. What are the best sources of calcium? And so we can learn all about everything that calcium does for the body, but if we're not eating it, then what good does it do us? So we usually tell athletes to eat about 3 to 4 servings of calcium a day, and so obviously dairy, as you guys know, is a great source of calcium. So you go with milk, cheese, or yogurt. But then there are a lot of options that are dairy-free, which are important for athletes that are following plant-based diets, like vegetarians, particularly vegans. Very important for people who have lactose intolerance or milk allergy. So I have some things here. A lot of people don't realize that there are types of orange juice that are fortified with calcium. You really have to look at the label and make sure it says calcium fortified on it, like this Tropicana one does here. All stores make their own store brand of calcium fortified orange juice. So you could usually get it at a better price if you buy a store brand. Okay. These are your traditional sources of calcium, which you guys have probably heard of, before, as you mentioned, milk, cheese. But then salmon, especially canned salmon, because the bones are in canned salmon, and that's where the calcium is. Kale and broccoli, good sources, sources of calcium. And then down here, you can see just the abundance of plant-based milks that are on the market today. And almost all of them are fortified with calcium. So, you see oat milk here, you see almond milk here, you see rice milk here, soy milk, coconut milk. Make sure you read the label, but 9 out of 10 times you're going to see where they have calcium or vitamin D added to them. All right, so now you guys know how to grocery shop to get your calcium. But what if you're someone that's not going to be able to follow through with that regularly? In some cases, I might recommend a calcium supplement, but dietitian's always a food first philosophy. But we do want to talk about the option of taking a calcium supplement. So there's a variety of them out there to try. Two of the best absorbed forms of calcium are calcium carbonate or calcium citrate. The ones we're looking at here are basically candy that have calcium added to them. And why I'm showing that to you is because people are compliant with them, meaning because they're candy, they like them and they'll consume them daily. Regular calcium supplements typically are really large pills that are hard to swallow, and people are non-compliant with that. So these calcium chews are effective. Most of them contain calcium citrate. You would take 2 a day, but you would need to split the dose. All right, and this is important to know. Your body can only absorb about 500 milligrams of calcium at a time. So you might want to take 1 chew in the morning and 1 chew later on in the evening. All right, and so again, these might be important for vegan athletes, athletes that are lactose intolerant, and those with milk allergies. All right, so on to vitamin D, which is very exciting these days because when I first became a dietitian back in the day, really when we talked about vitamin D, it was mostly just about bone health. But now we know so much more about vitamin D and how important it is for athletes. So I have a video here. I'm going to embed it into content so you guys can watch it. I'm not going to have you watch this video within a video, but you really do need to take time to look at it. In this video, they interview Randy Bird, who is a sports dietitian, and he talks about what they do at the University of Virginia in terms of supplementing their athletes with vitamin D and why. Okay, so really good to watch. Real life experience here going on. All right, so what does vitamin D do? Basically, vitamin D is important for absorption of calcium from the food you eat and for what we call bone mineralization. That means incorporating calcium into the bones to help with bone building. All right. But there's a lot of research out there now showing that there's a real positive association between vitamin D, okay, and athletic performance and injury prevention and healing. So if you look here, there's like a lot going on with vitamin D. So as I mentioned, it can help prevent injuries, it can help with rehab, it can reduce inflammation, reduce the risk of stress fractures, respiratory illness. This is kind of cool. It's associated with an increase in type 2 muscle fiber size, and it can help improve neuromuscular function. So again, not just about bone health for athletes, super important. All right, so with vitamin D deficiency, what might you experience? Well, compromised immune system, okay, meaning that maybe you have colds, flu, and you're not getting better. Maybe you tend to be have colds and flu or colds more often than other athletes on your team. Muscle weakness and pain, not recovering from workouts well, increased risk of injury, and then it can affect you mentally with depression. And then lifelong things could be certain types of cancer, heart disease, and hypertension. So let's talk a little bit more about who's at risk for vitamin D deficiency. So athletes, and honestly, most people in general, do not eat enough vitamin D, and that's because it's hard to get from foods. You do make some vitamin D when you go out and expose your skin to sunlight. There's a compound in your skin, type of cholesterol, that when exposed to the sun, um, starts to be converted into vitamin D in the body, right? However, many athletes practice indoors and compete indoors, and so most of their day is spent not in the sun, and that puts these athletes at a greater risk for deficiency. If you have a dark complexion, you have to be out in the sun longer to make vitamin D, right? If you go out and train early in the morning and in the evening, there's low levels of UVB light, which is the light that starts that conversion of cholesterol in your skin to vitamin D. So you're not able to get that chemical reaction going in sufficient amounts. So all of these athletes, basically, the way I look at it is that since most athletes don't eat enough vitamin D, they probably all need to be able to consider taking a supplement. All right. So when you buy vitamin D, I'm going to come over here. You want to look for the most active form of it, and that is called vitamin D3. Okay. And just a cautionary note, it is possible to get a toxicity of vitamin D, but you would, again, have to take really high doses of it. And this amount, one to 2,000 international units as a supplement, is not going to cause that and actually is beneficial for athletes. So we do want you to know the foods that are high in vitamin D. So if you like salmon, it's a great source. Tuna is a great source. Orange juice that is fortified with calcium and vitamin D, as we saw earlier. All your milks are pretty much fortified with vitamin D. I don't know if anybody likes sardines, but they're a great source. Egg yolks have some vitamin D. Some cereals have vitamin D added to them. And then again, your plant-based milks, most of them are fortified with calcium and vitamin D. So if you're eating these things regularly, um, and a number of servings of them throughout the week, that would be extremely beneficial for you. All right, so we're going to end this PowerPoint here. When we come back, we're going to talk a little bit about iron. All right, see you next time.